right, good morning and welcome everybody to the Never Stop Healing podcast. This is your host of the morning, Cade Archibald, and I am stoked about today's podcast. We got with us Regan Archibald. How's it going, Regan?
Really good.
Awesome. Well, I'm excited to dive in. We had an awesome hack last night. If you're not a part of the Health Accelerator community, please go to acueastwest.com/hack. That's where you can get some really cool access to our amazing community there and become a member of the Accelerate Wellness programs. Reagan's the creator of that and seeing amazing outcomes and results for those people there. So let's last night we had some challenges that we put out there. One of the big ones was cold shower or get some nice cold exposure. I took a great cold shower this morning. My hair kind of shows it. But yeah, how did everyone do it? Just raise of hands. Looks like we got some live people on here that were on last night. Hopefully you had a chance to take a cold shower and take advantage of that challenge. What was the other components, Regan? I know there was cold shower and something else, or was that it?
That was just the challenge, is cold exposure, because what we're trying to do is increase NAD. And so NAD has been shown to be increased in the liver with cold exposure.
Awesome. Love it. All right. Well, let's dive into today's topic.
Okay, so today's is going to be interesting because we're going to talk about a couple different things. One is we're going to show you, a little more research on stents and cardiovascular health, and then we're going to jump into a couple peptides like thymosin beta-4, niacin. We're going to show you how to supercharge some of the NAD. We'll kind of cover that as well, but the very first thing is we're going to jump into is saturated fats. And so we haven't talked about this in a while, and I think it's really important to start looking at it because right now heart disease is still the #1 killer in the United States. In fact, it's 1 in 3 people, 1 in 3 adults suffer from cardiovascular disease. And I'll show you some of the stats here. I'll pull up my screen. And then we can chat about this. But how many of you have ever been concerned about heart disease, and you're kind of frustrated because the current model of healthcare that we have is, well, let's make sure your blood pressure is low and let's make sure your cholesterol is low. And so several of you are raising your hand where it's like, yeah, this is we're not getting to the root cause. And so heart disease, the big problem with it is the day before a heart attack, you can have a clean bill of health. And I know Cade and I, we've talked about our dad's story on this, where Cade was in a motocross race and my dad's there watering the track. And suddenly he starts getting that sure sign of shortness of breath, pain radiating down his left arm. And luckily there was an ambulance 10 feet away. So he was able to go in there and, got taken to the hospital. Cade, in the meantime, had an accident on his motorcycle, has no idea where his dad is. And it turns out my dad needed, stents put in his heart, and he was about ready to have a massive coronary event. And this was when he was in his 50s or early 50s. So, pretty crazy scenario, but the interesting thing about it is, just a couple weeks before, because how long had you guys lived in Delta, Cade? This was like just a few months of being there, wasn't it?
Oh no, we'd been there for a few years.
Few years, okay. So, but one of the things that our dad had just recently had his blood work ran, and everything looked great. And the doctor jokingly told him, "I wish my labs looked as good as yours." And then he, almost dies. And so what we're going to be talking about today is something that literally could save your life and somebody else's, if you start looking at labs in the correct way. And this is where the reason I wanted to bring this up is because I'm seeing people younger and younger have some of these early signs. People in their 30s and early 40s are having signs of cardiovascular disease, but there's nothing being done about it unless you come in and actually start modifying lifestyle and helping create some awareness around it. And so one of the things that you'll get out of today is exactly what to look for when you're looking at your labs and looking at them differently. And then also hopefully gives you some motivation to go get your blood work ran and take a look at these numbers, because death by surprise is something we want to avoid. I mean, you're going to find out if you've got heart disease, one way or the other. I'd rather know long before it showed up so I can do things to circumvent that problem versus waiting until I've had a cardiovascular event. So this will be the first section of the podcast, is talking about this in pretty great detail. So, Cade, any thoughts on this? Problems with that topic?
Yeah, I just don't like it. No, this is great. No, I think that story around Dad is I would imagine it's not abnormal to hear stories like that and to have other people kind of experience those similar things where we got this clean bill of health or supposed clean bills of health, and really there's some underlying stuff that people just don't know that's going on. Because the first symptom people experience with heart disease is usually a pretty dramatic and traumatic event. And so I think this is a really important topic to jump into.
Well, or non-dramatic, because 50% of people, the very first sign they have is death. So that's, I mean, I don't know what it's like to die. I haven't died yet that I know of, obviously, but yeah, that's so it might be a non-event, but it's we don't want you to leave the earth early. So cardiovascular disease, by 2035, it's projected 45% of the US population will have cardiovascular disease. It's the interesting thing is $1.1 trillion is the annual projected cost for cardiovascular disease, is what it will be next year in 2023. There's $555 billion is spent on cardiovascular disease. And you may think, well, my insurance is picking this up, but actually one of the interesting things about our dad when he left the hospital after his surgery is they put him on 3 medications. They put him on a blood thinner called Plavix. They put him on a hypertensive med, and which was a beta blocker, and then they also put him on a Lipitor, which is a statin for cholesterol. And it was interesting because he just had his lab work done and he didn't have hypertension, he didn't have issues with hyperlipidemia or high cholesterol, but yet they had to put him on. And Plavix is normal because you've just got stents and they want to make sure there's no clots that could lead to a stroke or an aneurysm. So we get that, but one of the main reasons why he had to be on those medications, and so many of you, if you've ever experienced this, is that's the only way they can get reimbursed for the operation, is if the patient is prescribed these medications that now they're on the rest of their life. And so it is expensive, not just from the medication side of things, but my dad's energy wasn't as good. He just felt like he had loss of balance. I remember talking to him, several times, and we just realized his blood pressure was way too low, and he was having a bit of a reaction to some of the statins. So this was an interesting opportunity where we said, well, let's start looking at what is the root cause of heart disease, and maybe we can help save some lives just by looking at things a little differently. And one of the things that I had an opportunity to do recently, as in about a month ago, I was in Dallas, Texas, and I was able to go and teach some functional medicine concepts. I taught on peptides for longevity, but this was to a group of participants who had just had an advanced bioscan. And so they went to get their whole body scanned, complete MRIs, CAT scans of everything. to determine if they have any cardiovascular disease. The scan was so sensitive, and it literally took 4 minutes. You leave your clothes on, it's very quick. Steve Marler is the individual who orchestrated this, and Steve and I will, we've been talking frequently. We'll be working together very soon at East West, and we have plans of bringing in this technology. But the interesting thing that we were able to see in these scans is you could see, calcium that was starting to peel off the arteries, and that loose calcium is what can be deadly. And so he was able to save lives there. The other thing that was showing up was you could see calcification in the aorta. And Cade, I don't know if you've seen that on our x-rays. Have you seen those x-rays where we've had some patients come in and we've scanned their spines with our x-ray machine here in the clinic, and we've actually said, hey, we need you to go to see your cardiologist because you've got pretty advanced plaquing in your aorta?
Yeah, it's pretty wild. It's cool that we have that technology, but yeah, there's some instances where and they usually don't even, like, it's a huge surprise.
Yeah. Yeah, and then being on blood thinners, warfarin is a very common blood thinner. Yeah, that's what we put in rat poison. So it puts your body at risk of having obviously bleeding out and having injuries, and your vascular integrity gets weakened. So if we can help you do some things to get your cardiovascular system healthy, I think that's one of the main things. But also getting these advanced scans, and what we have here is just an x-ray, so it's not nearly what Steve Marler is using. But I'm just illustrating the point that sometimes the calcification is so thick, and your aorta, by the way, runs all the way through your abdominal cavity. It's right against your spine, so it's a very big vessel. And then you have your aortic valves, and part of the aorta is in your heart as well. But if you get calcification and that calcification breaks off, that's what causes strokes. And so that's where it's so critical to look at these things. But the other thing that it showed in these images when I was at this longevity conference is you could see cerebral shrinkage. A couple of people had undergone chemotherapy. You could see cerebral shrinkage. You could see if the thyroid had goiters on it. You could see any issues in the colon that would warrant like a colonoscopy. You could see osteoarthritis in the joints and ligaments. You could see, damage there. I mean, it was such a very enlightening experience to see. But then the other thing we did is we looked at all the physiology, because that's kind of looking at the anatomy and seeing if there's any structural issues, which is really important. But then looking at the physiology, as Steve's group ran blood work on everybody, and then I was able to go through and read the blood work. And so that's is my passion, something I'm obviously super invested in, interested in, is looking at blood working, making sure there's no surprises that are going to take you out of the game early. So
Yeah. Hey, Regan, we had a question come in on signs of heart attacks for females versus males. So Diane said, I've heard that women's signs of a heart attack are different than a man's. Is that true?
Not necessarily, but women's signs can actually be a lot more benign. So a man may have more shortness of breath, more pain radiating down the arms than a man might. But in general, what we're seeing is that females, they are super high risk, especially when your estrogen levels start to drop. And it doesn't, it is, and I think to your point, Diane, and I appreciate asking that question, is there's some major things, but what you'll notice between men and women is that, obviously there's different biology. You're going to see different cholesterol plaque that builds up inside of the walls. Some of the signs that you'll have in men that don't necessarily transfer over in women, and this is where with women, a lot of the cardiovascular events can be from stress related, like a Takotsubo cardiomyopathy, and so that's where your heart gets inflamed. and it's usually from an emotional stressor. So, but some of the differences you'll see is when with men specifically, and this can this can transfer over, but women typically will experience chest pain, where men will experience chest pain with nausea, sweating, vomiting. They'll get pain in the neck, the jaw, the throat, and the abdomen. So, so once again, females tend to have their symptoms are less dramatic than men's. So, don't take your chest pain lightly, females. All right, so hopefully that answered the question. So what is it that causes this? Well, it's an injured endothelium, and this is kind of interesting, because what happens when you have these small particles and these small LDL particles, there's a difference in your cholesterol, and we look at the LDL as like sending in the fire department. So whenever your blood vessels get damaged, and if you read the book Why We Get Sick by Benjamin Dickman, one of the big contributing factors of vascular damage is when we have blood sugar that goes up and down and up and down. And so for those of you who are eating like 1 meal a day, or you do a lot of fasting, that's great. But the problem with that is, in what we see in the blood work, is that you're stressing your body out too much. And so you're actually causing some too dramatic of drops in your blood sugar throughout the day. And then if you have stress on top of that, like we work with a lot of very successful entrepreneurs, people who are doing big things in their life, like all of you on the show today, and people who are really trying to optimize their health. But what we find is that sometimes if you're pushing yourself and fasting too much, you could actually be doing more injury than good to your cardiovascular system. With that said, that's where time restricted eating, a 12 to a 14-hour window, for 4 to 5 days out of the week, and then you can extend it more on the weekends where you fast a little longer. That's a great way of keeping your blood vessels healthy. But when you start to have an increase in LDL particles, specifically the small particles or the oxidized LDL, that's when you start getting damage to the endothelium. And what we've done traditionally to treat it is throw a statin on it. And so the statins, essentially, they pull the LDL particles out of the blood, so that you're not seeing it, but the damage is still done to the endothelium. And that those endothelial cells, long term, start building up more and more plaque, and then eventually that plaque, you have a complete occlusion in the artery, or you have what's called a ruptured thrombosis, and that's where you can throw a stroke, or if you do have an occlusion, then really what we do is, we provide stents, and then we'll get into that in just a minute. But here's an interesting study. This was published in January 13th of 2016. So Cade, I guess if you look historically, you remember who Ansel Keys was?
Yeah, he's the anti-fat fella, right?
He was with the Eisenhower's administration, and he was like, hey, fat is deadly, and
yeah.
And unfortunately, he, that went to fat-free everything in our society, and the end result was not necessarily, oh, cool, it's now we've got less cardiovascular disease. Actually, we got more. And Eisenhower, if you remember him, just a phenomenal general of the war, and came in to the White House and suffered from a massive heart attack, and he's like, how can this happen? And by the time he left, he had Crohn's disease, and because Ansel Keys, and based on his recommendations and findings, Ansel Keys basically put him on a dry diet, no butter on the toast, 1 egg a week. And it was just a ridiculous diet that he was on. And he actually got autoimmune diseases like Crohn's. So his digestive system got wrecked, because that's when we built the food pyramid, where grains are at the bottom. And so it's really, if we start looking at this atherosclerotic coronary heart disease, and by the way, one of the big killers when it comes to aging is the atherosclerosis, and that's where you start getting these plaques built up in your arteries. So one of the reasons here at East West we're so big on cold exposure, on exercise, on eating the right foods, stretching your body out, having a nice mindset morning so that your heart's open every day, is so that you can have these healthy blood vessels. And those healthy blood vessels will serve you for so much longer if you take care of them early on in your life and take care of them throughout your life. So what's going to cause damage to these? And what they looked at is they looked at sugar consumption. Does it play as much of a role in basically plugging up arteries as saturated fat does? Because for years we thought it was saturated fat. I remember even as a kid, because our mom was so into fat-free, which is great. She was trying to be healthy, but when you look at those, the fat-free stuff, I'd automatically think if I ate a bunch of butter, that's just going to be, that fat's going to be circulating in my blood and clogging up my arteries, and so I'd be all nervous as a kid. But it just doesn't work that way. If you have bile salts, is what emulsifies the fats and breaks down these fatty acids, which become part of the overall structure for cellular integrity in your cell membrane, and really good for the brain as well. But here's what the study found. This was January 13th, 2016. And, basically the conclusion was sugar consumption plays a greater role in heart disease than saturated fat. And they said the atherosclerotic coronary heart disease is responsible for 1 in every 6 deaths in the United States, as well as being a leading cause of death in the developed world. Healthcare professionals have sought for years to limit this. And so this study is going to focus on prevention and eliminating saturated fats. And so what they found in that is, this theory was developed by Ansel Keys, and we already talked about that. And they kind of give some overall perspective on it, but they said that, number one, the metabolic aspects of saturated fatty acids are complex, but suggests that certain saturated fatty acids may offer measurable benefits for lipid profiles and coronary heart disease risks. So this was discovered at the Albert Einstein School of Medicine. They looked at 60 years of data, and they looked at the two opposing philosophies between, is it sugar or is it saturated fat? And they actually, in all the literature that they scanned, they found that there's more benefits. There actually is measurable benefits for saturated fats. The other thing they found is saturated fatty acids increase high density lipoprotein cholesterol, or HDL, which is often referred to as the good cholesterol. And by the way, if your HDL cholesterol drops too low, that could be a big issue with your thyroid. So this was a massive study, one of the biggest of its kind, just showing that maybe what we thought about heart disease is wrong in the first place. So they found that consuming a diet high in sugar for just a few weeks has been shown to cause numerous abnormalities found in patients with coronary heart disease, such as high cholesterol, triglycerides, LDL, oxidized LDL, uric acid, insulin resistance, and abnormal glucose tolerance, low HDL, and altered platelet function. So it's the sugar is kind of the end. That's it causes what are called aging, which is advanced glycated end products. So this advanced glycation in the blood vessels from sugar, it's like burning off your blood vessels. So it could be one of the things that you'd want to consider. So Cade, what are your thoughts on that? Sugar consumption, heart disease?
Yeah, it's pretty crazy what sugar can do and how inflammatory it can be. And so I think in the past, those low-fat diets have always replaced things with sugar, and it's just really, really detrimental. I know whenever I go really strict on cutting out sugar, I feel better, I lose weight. My joints feel better. Everything is just way better when I try to eliminate as much sugar as possible.
Man, it's massive. And that's why in our 60-day reset, and actually we just say it's 60 days, but we just want you in your Accelerate Wellness program. For everyone in our community, we take you through, there's 6 essentials in each of the 2 months. And the 6 essentials in your reset phase is no more than 1 gram of sugar. And so and everyone's like, well, why don't you just say no sugar? Because it's basically no sugar. But it's easier if you say, well, if it's something that has 1 gram of sugar or less, then you're fine. If it's got 2 grams per serving, then eat a half of a serving so that you stay below that 1 gram. But it's so much easier from a mental perspective. And so so this is one of the things that they're discovering. And one of the treatments that we've done are stints. And I'm sure many of you either have stents or have been recommended them, or possibly you are, you know somebody who has stents, but they're finding that maybe the stents are not offering the benefits that we thought. And this was a large study led by Stanford and New York University, that they found that some of these invasive procedures were no better than medication and lifestyle advice at treating heart disease that's severe but stable. So, so I thought that was kind of an interesting overview. And so even the British Medical Journal, they've published some very similar things on clogged arteries. And one of the big things that they came to the conclusion of is that it's insulin resistance and systemic inflammation. So when we talk about removing interferences, one of the big interferences that we're removing with our patients is anything that's going to trigger insulin resistance or systemic inflammation. So and then we build up deficiencies. So we're removing interferences and then restoring deficiencies. And it's a really important part of keeping your blood vessels healthy, because as your blood vessels are healthy, you're going to notice that you have better energy levels. Your brain works much better. You'll find that your chances of getting Alzheimer's or dementia, especially if it's vascular dementia, which relates to a circulatory problem, you're going to feel so much better, because you're not going to have these risks if you have a healthy cardiovascular system. Because your body, every cell in your body depends on blood vessels. And if we were to link your blood vessels, take them out, they're at 60,000 miles worth of blood vessels, and that could wrap around the planet twice. So it's a lot of, it's a massive infrastructure to take care of your body. But one of the things you'll find that can help is, and this was in the studies published in the British Medical Journal, they found that vegetables, extra virgin olive oil, certain nuts, oily fish, moderate intake of cheese and yogurt, low in sugar and refined carbohydrates, regular physical activity, stress reduction, smoking cessation, that all helps with, avoiding the coronary artery plaque. The other thing that they found is that can trigger it is, if you have insulin resistance, then you have a hormone called aldosterone, and that hormone can really start increasing your heart rate and it can trigger some hypertension. So check your blood pressure often. Check it when you're sitting, check it when you're standing. Ideally, when you go to sit to rise, if your blood pressure drops, you've got some significant problems with electrolytes, your kidneys, your adrenals. So checking it sitting in and then checking it standing is really important. And then the fatty acid profiles. And this is one of the reasons we run metabolomics, is because we want to look at your fatty acid profiles. And so if you have too much omega-6 and not enough omega-3 fatty acids, like you're getting your fats from carbohydrate sources or fried food, those omega-6s can really start causing systemic inflammation. So metabolomics is a simple urine test that you can take, and you can see the oxidative stress factors upstream. You can see if there's any mitochondrial dysfunction, because the mitochondria is so important, and especially in the cardiovascular cells, the cardiocytes. And then you can also look at any toxic burden, toxic exposure, along with these fatty acids. So get the metabolomics with your blood work, and that gives you a much better perspective on what's going on. So, all right. So should we jump into labs real quick, Cade? Do you get a little nerdy on this?
Let's do it.
Okay. And any questions that you guys have as we go through this, just stop us. And then what we're going to do is go through some of the the major labs that you want to look at, and share a little case study here. But you can see a particular patient we ran their labs on. You can see kind of some before and after, but there was blood sugar and insulin resistant improved, but the renal function was still down because stress was such a big deal. And this was a patient who had, chronic kidney disease, kind of at that, stage 2, stage 3, looking for some support, didn't want to get on dialysis. And so, so wanted to work on lifestyle things and use some peptides to help, get their body back in balance. But you can see one of the very first things we went to tackle is we said, all right, in the next 6 months, if we don't improve your blood sugar, it's going to be almost impossible to improve your kidney function. And so we went to work at that. And this patient, went from a 5.8 to a 5.6. So went from, pre-diabetic to not pre-diabetic, just a little bit over, still a little insulin resistance. Glucose went from 118 to 101. On the fasting level, which was great. GFR stayed about the same. Sodium potassium ratios, sodium dropped just a little bit, but this patient also had an enormous amount of stress that came into their life at the same time. And so the Annie and gap improved because we're working on the digestive system. But the biggest thing that improved, as you can see here, is the fibrinogen. And fibrinogen, when your fibrinogen's elevated, that means you've got tissue degradation in your body. Like certain tissues are in a catabolic state, meaning they're being broken down, and your body just is essentially falling apart. But then the C-reactive protein, you can see it was an 8 and it went down to a 1. So this was a very positive thing. Thyroid peroxidase antibodies, she was still in a little bit of a Hashimoto's, just mini. We wanted it to be below 5. But that fibrinogen let us know we're on the right track. So not only did her C-reactive protein improve by 800%, but her fibrinogen, it went back into the normal range, which was awesome. And C-reactive protein is one of the major markers that we look at when it comes to, cardiovascular risk, cardiovascular stress. Vitamin D looked good. Her DHEA was still a little lower. We didn't want to, start manipulating with that too much. But now we said, okay, we're going to start working on hormones more. So we ran our hormones as well. So this is something that, part of what we looked at too is we looked at her ferritin levels, because ferritin, her ferritin had always been above 300. And so that was a very positive shift, as it went from 379 to 266. And then even the total cholesterol dropped a little bit low, and this was not on medications. But we saw this and we said, okay, overall inflammation was substantially down. She was feeling a lot better. So that was a positive finding. When we looked at her electrolyte balance, we said, okay, we've got to work on electrolytes, blood sugar. Those were our priorities. She also wasn't emulsifying fats, so working on digestion was the other next step. So some interesting things. And one of the big peptides that we used was thymosin beta 4. And thymosin beta 4, Cade, this peptide, but what are some of the thoughts that you've got on, well, first of all, that case study, but then also on maybe thymosin beta 4?
On thymosin beta 4, I love that one. I've used on and off for really significant amount of time last couple of years. Biggest thing I noticed with thymosin beta 4 is muscle soreness and ability to recover very quickly. So it's one of my favorites as far as like a continual use option, at least for my kind of peptide regimen. Love using that one really regularly.
Yeah, it's a powerful peptide because it does promote angiogenesis. So if you've got blood vessels that have been damaged, and if you think about like when you're putting stress into your muscles, you're literally damaging the muscles, right? And the blood vessels, and so when those muscle fibers are breaking, then you need something to come back and create bigger muscles and reparative factors. And that's what keeps your body young, is if you can continually repair from this process of breaking down muscles. And so thymosin beta 4 promotes better blood circulation there. It activates actin, which is important in building proteins. And so it also helps in wound healing. It activates stem cells. It enhances cell migration. It's good for hair growth. So you can inject it into your scalp. It's a potent anti-inflammatory. It restores neurons post-traumatic brain injury. It also prevents adhesions of injured tissue. So thymosin beta 4 is secreted from the thymus gland, but it's also really good for the immune system. And it can be taken orally, it can be an injection, you can even use it topically. I've seen this provide incredible results for patients who have had coronary arterial disease. We actually got a letter from one of our patients just a few months ago, and her doctor actually said, "You no longer have cardiovascular disease." And then it was the same thing, we've seen this with another patient who had had 2 cardiovascular events, and now he's basically been able to decrease his medications with his cardiologist. He's feeling better than he ever has, and he's actually back to work. So as a dentist, which has been super exciting to see. So thymosin beta 4 is usually one of the core peptides that we're going to have to help you recover, repair, but especially if you've got any cardiovascular history or threats, this is a great peptide for you. So some of the uses, it can be used as anti-aging, autoimmunity. Remember, it comes from the thymus gland, which is where your major immune cells are trained. It helps with the skin, the brain, the eyes, the heart, the liver, wound healing, scar tissue. Great for any post-regenerative medicine therapies. Everyone who comes in our neuropathy protocol gets thymosin beta 4 so that you get this activation of new healthy nerves and blood vessels. Thymosin beta 4 has unique anti-inflammatory properties. Works like in Lyme's disease, chronic fatigue, fibromyalgia, any kind of infection. So a very, very fun peptide for me because it helps with recovery. The other interesting thing about this is if you look at it from just what it can do for the brain, thymosin beta 4, it's typically found in both muscles, the skeletal and smooth muscles. So smooth muscles are what you're going to find in your blood vessels because they're contracting, or in your gut, your digestive system. And then obviously skeletal muscles are what allows you to move. But thymosin beta 4 is first released in any trauma. So if you have a cut, very first thing that gets activated is this gene for thymosin beta 4. And then thymosin beta 4 goes to work at recruiting stem cells to help heal different areas of the body that have been damaged. And if you're watching our YouTube video, you can see this image where you've got this progenitor stem cell that's just waiting to be called into action. And then there's an injury, or there's a cell that dies off, and the progenitor stem cell gets called into action. It's thymosin beta 4 that's right there that helps the cell mature and take on a specific lineage. And then what happens is thymosin beta 4 also downregulates inflammation in your body. It induces tissue regeneration and inhibits scarring. So this can be used in, for the brain and like strokes, trauma, MS. And once again, peptides are really powerful because they're the same excretion that your body is emitting. So, unlike supplements or herbs where we don't know if they're getting to the right place at the right time, peptides actually activate the right channels, and they do it in a way where usually if it's an injection, you can bypass those particular channels and get it right to where it needs to go. So from a cardiovascular perspective, it helps with myocardial infarction, chronic heart failure. In the eyes, it's been shown to be beneficial for dry eyes, for wounds, for burns, for infections, chemical injury. There's even eye drops that you can use with thymosin beta 4, and then on the skin for ulcerations and wounds and burns. So thymosin beta 4 is absolutely a favorite. Some of the foods you can add in there is add some garlic. Taking garlic, in 2014, they suggested that garlic could prevent heart disease. 2012 studies showed that aged garlic extract, when combined with coenzyme Q10, slowed the progress of atherosclerosis. Remember that atherosclerosis is one of the biggest things that can terminate your life early. So hopefully that gives you some ideas there. You can take niacin. Niacin's a great way to flush the cardiovascular system. Hawthorn, this is a great remedy in Chinese medicine, taking some hawthorn tea. Hawthorn does contain quercetin, which has been shown to lower cholesterol. And then one of the big ones for lowering cholesterol is your red yeast rice extract. And so similar to what, statins are made from, but usually a lot less toxic. So yeah, these are some interesting things you can do for your heart. Some other things are like sarcotropin, ipamorelin. That's a favorite of ours for cardiovascular health. And then continually keeping your growth hormones as healthy as possible, because the growth hormone secretagogue like CJC1295, ipamorelin, MK677, sermorelin, these are all really good peptides to keep growth hormone active and healthy as if you're a young kid again. So yeah, there it is today. So takeaways, Cade, from today, or things that people can do after listening to this.
I think number one thing is like know your numbers. So get some labs done. Reach out to us. You can find us at acueastwest.com or shoot us a text or call at 801-582-2011. And we can help with the blood work and getting the right numbers. The other component is get some really cool, effective peptides. We talked about thymosin beta-4. We talked about just some really cool ways to repair tissue and increase cardio function. And I think those are really rad. Well done.
Love it. All right, you guys.
Had a question come in. My cholesterol is really high. Definitely is from being hereditary. Definitely do not want to take a statin. What else can I do?
That's an awesome question, because if it's hereditary, and this happens in about 5% of the cases, so the big thing you want to do is just, once again, you don't want your LDL cholesterol to get too high, but that's usually where the problem is from an overall perspective when it comes to hereditary. But the other thing you can do is make sure your ferritin levels stay normal, your homocysteine and your C-reactive protein. So look at what you can control, and there's other variables that you can control, like blood sugar and things like that will really help. And then just avoiding the sugar, anything that causes inflammation in those blood vessels, that's going to be the big thing. And then if it were me, I would go get the advanced bioscan, and you can look at, I believe the company's name is Advanced Bioscan, but I would get an advanced bioscan often, like once a year, to make sure that there's no threats.
Love it. Well, awesome content today, Regan. Thank you so much. If you guys are not part of our weekly hack community or health accelerator challenges, and you're not in an Accelerate Wellness program, go to our website, check it out. This is one of the most impactful ways you can get help is working with us in a deeper level. So go to acueastwest.com. You can also reach out to us at our number 801-582-2011 for East West Health. Awesome. Thanks so much. We'll be back same time, same place next week. And see you then.
Bye, guys.